And I will say that I absolutely have, in my 15 years of working in this space in the Metroplex, I believe one of my strongest, if not the strongest, board of directors and leaders. And if you're here, if you could stand, there's several members of the board of directors of the Continuum Care, MDHA here, Ellen and Dave, Ashley and Ed and Ricky, Shanette. Excellent. Kyla, I'm seeing everybody. I apologize if I missed. So thank you very much. I also want to recognize, before I get into the data and the information, I want to recognize those individuals that are part of my team that work every day, evenings, weekends, and tirelessly to meet our mission, which is to lead in the development of an effective homeless response system to make homelessness rare, brief, and non-recurring in Dallas and Collin Counties. And so my team, way up, my HMIS team, I saw Lester, he walked in. Yay, Victoria, in the back, thank you. I have a great team. The purpose of the State of the Homeless Address, I think this is my 10th, maybe my 11th State of the Homeless Address that I have done. This is my 4th one here in the Dallas area. And we're going to look at the data and the work that was done by volunteers. We're also going to look at some of the information about some of our performance throughout the year. And as is with almost every entity and organization now, everything is said to be data-driven, and that the data informs us and helps us to get better ideas to understand what is working and what is not. So we're going to go into the State of the Homeless Address. First of all, as many of you may be here in this room, participated in the point in time count. It was held in the state of Texas on January 25th, 2018, and we went out a little earlier this year. It was in the 50s that night compared to in the 20s the year before. Part of the methodology is just understanding how sometimes weather can impact our numbers. We had over 1,500 volunteers. There were a lot of volunteers who never signed up, and we just, at some point, we just stopped counting. And I think we have found the sweet spot. That is how many volunteers that we need in order to get the kind of coverage of the unsheltered homeless. Again, we use that Counting Us app, which allowed us to have a quicker survey, non-paper survey. And then we took all that data, compared it to information that we had in the HMIS to deduplicate. One of the advantages this year that we have is that one of our goals was last year we did the app, and it was too easy to just do an observation only and not ask questions, and that questions were really important. And so the yellow line and the yellow bar for most of this presentation will represent the current year. And so we got a lot more information from those individuals experiencing homelessness, and that helps in understanding the nature and extent. And as you know, I wanted to know where the data comes from. So HMIS system, the Homeless Management Information System of People Sheltered. For those organizations that do not use HMIS, or for our domestic violence shelters, we handed a uniform, gave them an Excel spreadsheet of which they filled out so that we could deduplicate. The Unsheltered, of course, came from the Counting Us app. And so all that data has been analyzed to come up with our numbers, and that was done by Lester Collins in the back to make sure that we follow the HUD requirements to assure that this is the most accurate count. And so here's the count. So what we're looking at here is breaking down as how many unsheltered homeless we had in both Dallas and Collin County, 1,341. That represents a 23% increase in unsheltered in 1 year. The emergency shelter, 1,991. Part of that increase is due to we changed, Family Gateway had a transitional housing program that converted and operates much more like an emergency shelter. And so we have a slight reduction in transitional housing. Safe Haven is a long-term program for people experiencing severe and persistent mental illness run by MetroCare Services. Last year they had a few beds that were out of service. This year they were, and they're back up to 23. So our new number is 4,140. That is an overall 9% increase in homelessness in Dallas and Collin County. So my friend Tammy McGee, who has the job that I used to have, did her State of the Homeless Address on Monday. And I wanted you to see what their increases were. In my experience, usually what happens in Tarrant County, we also seem to see the same thing in Dallas and vice versa. As a Metroplex, a lot of our data tends to track. she had a very dramatic increase in unsheltered homelessness in Fort Worth, primarily the Fort Worth area. And so overall, they had a 5% increase. Ann Howard, who is my equivalent in the city of Austin, she estimates that they're between 7 and 9%. They haven't finished doing their calculations. San Antonio, also an increase. We also know from a HUD report that was published in December that overall in the United States, for the first time in many years, there is an increase in homelessness, primarily within unsheltered homelessness, a 9% increase across the nation. Most of this increase in unsheltered homelessness is in the top 50 cities in the United States, of which Dallas and Fort Worth are 2 of those cities. This tells us that it's not something unique about Dallas. There is something systemic in the United States that is feeding some of these increased numbers. So we also wanted to look at and see where some of these increases happened. Overall, 82% of the people who are experiencing unsheltered homelessness is in the city of Dallas. So we had a 215-person increase from last year. Some of the smaller suburban areas had a slight decrease, but all in all, it seems to still track. Overall, in Dallas County, 91% of that unsheltered homeless number of 1,341, that's where they reside. And then you can see in Collin County, 116 unsheltered homeless. So this gives us an idea of where the increases happen geographically within our community. This is just a map to show where individuals were found, and obviously the majority there in the middle, the 82%, you see in the central area of the city of Dallas. So now just to kind of look at some of the demographic changes of the unsheltered homeless. The actual, though, you see a lot more numbers. The rate was almost identical to last year. 78% of the unsheltered are men, 22% women, and it has been that trend for the last 3 years. The ages of the unsheltered, remember we're looking at the yellow bar. The black bar represents just last year. You can see that it is very much a phenomenon of middle age and aging. One thing that I want to note, and I brought this up last year and the year prior, is the aging of the homeless. Just from last year, 65 to 110. That is an extraordinary increase of people 62 and older. And we have to wrap our heads around that about how do we let our elderly fall into homelessness? And those that are soon to be in the elderly category. And that's a very remarkable. You can see the unsheltered population, the majority of them are 55 and over. So when we look at race, we have a slight reduction. Last year, we were closer to 70% of the unsheltered were African American, 30% white. When we take this as for the whole area, if we were to just pull out Dallas County, you're going to get close to that original 69% figure. So race has always been, and we're going to continue and talk about some of our other work, is a direct correlation to the experience of homelessness. So length of time homeless, and we talk a lot of times about length of time homeless because the length of time that you are homeless is one of the national measures to compare how well we're doing within the homeless response system. When someone falls into homelessness, how organized are we? What resources do we have that we can put together to end that homelessness? This number reflects the unsheltered, and of the 509, we have 1,341, but we had 509 respond to the question, which was a larger proportion. The average person has been homeless for almost 2.5 years. 277 had been there a year or more, and of that 277, their homeless experience was over 4 years. And then the 1 month or longer, the average time for people who've been homeless less than a year, about 4.5 months, almost half a year. So you can see how that trends. Households with children. The top line, the 301, these are households with adults and children's families. 301. So 301 households, and those households had 336 adults, 598 total children. So total persons and families, 934, a slight increase from last year. Unaccompanied youth or parenting youth, These are individuals who are under the age of 18. We had 64 in the emergency shelters. So when we just pull out those children, we have 662 children experiencing homelessness. That's 16% of the homeless. I will say, though, that it's dramatic when we see some of the increases in the last 2 years. There was a time where homelessness amongst children was upwards of 25, closer to 30% of the total population. So there has been good work done in reducing the number of children experiencing homelessness. Veterans is also another focus. It is one of the national goals of the United States Interagency Council on Homelessness, and our federal plan is to end veteran homelessness. We actually finally have got a relatively significant decrease. You can see that we had a total 319 of veterans who are adults, unaccompanied adults, and then we have households with children, so the total was 331. And that represented 7.9% of all the homeless. Last year, they were 9.5% of all of our homeless, 356. So we have realized a slight reduction. Chronically homeless veterans, which is a target of what's called the VA's VASH program. There's a lot of those folks that have been through that VASH program, and I will let you know that right now there's a tremendous retooling going on within the continued care and veterans, sort of reaffirming our commitment to ending veteran homelessness with some very strategic efforts that are going to be starting up in April and May. And welcoming Family Endeavors has a lot of new staff. We have dedicated coordinated assessment system teams, and so we're going to be continuing to work on the effort to end veteran homelessness. Here's another one looking at length of stay in homeless. This comes from an annual homeless assessment report. So this isn't point-in-time data. This is looking at an entire 12-month period of our data to look at the length of time. And you can see here, we usually say nationally, we know that when people present in emergency shelter, adults, usually somewhere around 60% will self-resolve without a subsidy intervention. They figure something out. They're able to regain employment. But then that other 40% tends to stay a lot longer because they present with a lot more barriers, multiple chronic conditions. But I also want you to look at families. Look how long. It's much more difficult. Think of the economic factors of a single mother with many children, having to put together the incomes, childcare, and all of the different things that require that. One of the things that has changed within the last year within our homeless response system and families is that Family Gateway started, and Ellen, if I get it wrong, at least 6 months ago, maybe longer. Used to be, you call, I need a place to stay. I'm sorry, our shelter's full. Give you some phone numbers. Now we're really entering into the space of diversion. We don't have a choice. Our homeless shelters are full. We can't just say, sorry, my beds are full. Now, through several diversion workers, they take that phone call at Family Gateway and they start asking questions. Well, do you feel safe? Have you already been evicted, or do you have your notice to vacate? Where are you? How many children with you? Are there family? How can we help? And they begin to do that, and they've had extraordinary success. I remember, Ellen, I think at least 200 families diverted from shelter. So that's going to be representing another one of our evidence-based practices that we're going to take not just Family Gateway and move that work into our individual emergency shelters. I already know that Austin Street Center has been doing a lot of research in this and trying to start that process as well because their shelter is full. One of the other subpopulations that we spend a lot of time addressing is chronically homeless. That means those individuals that have been homeless a very long time and they present with documented severe and persistent mental illness, significant physical and other disabilities and chronic health conditions. And they've also been homeless at least a year or more, or they have been homeless 4 times within the last 3 years, where the total amount of that time is a year. So you're looking at people who have continued episodic homelessness, severe disabling conditions, most times 2 and 3 and sometimes 4 disabling conditions, and are in our system. So we've actually had a really significant impact because some of the business rules we put into place and the full implementation of coordinated assessment system. So right now, the chronically homeless individuals, 152 of the unsheltered, 214 emergency shelter. The Safe Haven program had 383. And we have chronically homeless families, and we count all those as the metric we use, and so we have 424. Remember, that's a point in time. People fall into chronic homelessness over the course of the year. But at least this is a very important data point that we will be providing to HUD and shows some of our work with coordinated assessment that I'll go into later in the presentation. One of the things that we started in this coordinated assessment documentation process is that we make sure that it's not all just self-report. We're starting to glean the data and the documentation to know not just an estimate of chronic. Increasingly, we are knowing exactly how many chronic individuals we have, and we know a lot about them, their assessment, their type of disabilities, and we're doing our intervention to make sure that what subsidized housing we have, what housing we have available that is dedicated to people experiencing homelessness, we make sure those with the most severe conditions, elderly, long years and years of homelessness, are tapped to get that housing first. And so right now to date, 209, just under 50% when we look at our coordinated assessment list right now, are chronically homeless. So if we just take 209 and compare that prior number of 424, we're getting really close to 50%. My goal is that at any point in time, 75% of those known chronic homeless have gone through our coordinated assessment system, so they were more readily able to provide them the housing and services that they need and that they are prioritized. And so what is this thing called the Housing Priority List? And I have a copy of the one from last Monday. I keep telling individuals when I speak and we go to our committee meetings that I believe that this list is now, within the homeless response system, the absolute most important document for telling the community what the current gaps and needs are. It is updated weekly. Homeless persons are added to the list when they go through the coordinated assessment process. What happens at any level, it happens in shelters, it happens at street outreach, and it's done through the homeless management information system. And then as people leave the system or people are housed, they come off the list. And so this is the 1 year's worth. The reason those lines are going up is because we have more of our agencies utilizing this system because they know that this is step one in the pathway to identifying housing. The top line, the dark line there, this shows some progress in September. There were 231 chronically homeless, and now there's that 209 to date. So you can see this correlates and tracks to my presentation that we have had a reduction in chronic homeless. So what's that P5 and P8? I'll go into that a little more. Those are individuals who are experiencing homelessness, haven't hit the 1 year mark, or they haven't hit their 4th episode yet, but they have a documented severe disability. This is a category that we call at risk of homelessness. So today I've got 780 individuals on this list. I think it's about 12 pages long. Essentially, the first few pages of this list are the chronic homeless, and then in the middle it's those at risk of homelessness, and then the balance are those who don't have the same level of severity of service needs. The head of household doesn't have a documented disability. They are just there and have short terms in homelessness, which I just said. And the value of this is it's going to begin to organize the housing needs and gaps. And so I tried to say, how can I take a list of 780 persons and show you how it is organized? The length of time, it's ordered by length of time homeless, severity of service need using a common tool called the VI SPADAT, and the documentation of disabling condition of the head of household. In the last year, I pulled an APR report for my own staff's work, Natalie's work, I'm not sure where she is. 1,554 persons have been processed through coordinated assessment system. And 246 persons from that list in the last year from the housing priority list have been housed. That doesn't represent all the people that have been housed, but it represents those that we are able to factually document through the coordinated assessment system. And so this is how I've tried. I want to spend a little more time on this chart. This is me taking that list and breaking it down into kind of 3 key categories. One of the most extraordinary challenges that pretty much 99.9% of the people on this list would be categorized as extremely low income, deep, pervasive poverty. So I'm going to start at the bottom, moderate and low severity, what we call priority 9 through 10. The list today, there are 315 heads of households on the list. 210 are adults, 105 are families. The average age of those families is 44. The average income is $584. You've got a younger pool of individuals. A lot of them just have work, but it's you know, the working poor or part-time jobs. They're not careers, they're jobs, and oftentimes they're temporary and seasonal. And so when we look at it, housing needs and income needs. When we look at homelessness, I'm trying to break it down to you. A lot of people say, well, what about the mental health? What about the drug use? What about all these things? Well, it doesn't matter. People with mental illness, most people who are experiencing a mental health crisis are housed people. Most people who are poor are housed people. The uniqueness of the homeless population is their income is here, and the cost of affordable housing is here. And so what our strategies are for a homeless response system is, where can we find a little cheaper housing, maybe some subsidized housing, and is there anything we can do to increase that household income? But what we find, the 780 people, there's a gap. And that is what essentially is creating our homelessness. There is a gap. Now, there are things that may prevent these individuals from getting income and a job, and there may be reasons in their background why they can't apply or are eligible to live in the housing that may be available. And that also makes up our work. And so I've taken this list of 780 persons, and I tried to just a quick snapshot of what our gaps and needs are. So the housing needs that best suits those individuals where the head of household isn't suffering from a disabling condition, but it's a very strong economic issue. Maybe family destabilization, maybe getting fired, maybe divorce, maybe child support is stopped, maybe other benefits that they had got. TANF ran out and they still didn't have employment. So the type of housing interventions we look to would be rapid rehousing, which is short-term rental assistance with case management, transitional housing, especially in the space of our youth, young youth 18 to 24, and also families experiencing domestic violence. And because some of these individuals may have just need a little bit of help, our homeless prevention programs that maybe pay for an arrearage and try to capture them before they end up in shelter, and housing search and placement. Those are some of the housing tools that best suit individuals who are in that category. And then income, child care subsidies, right? TANF, food stamps, and employment, right? Because these are individuals that maybe not need a lot of mental health care or health care. They're really needing to get back on track. And so we need to target those types of resources to that population. The at-risk of chronicity, priority 5 through priority 8. Right now we have 265 households, 235 are adults, 30 families. The average age you're starting to see with disabling conditions, you're starting to see that which matched our unsheltered, what showed a lot of folks that are older. The average age is higher, 56 or 46.4, significantly lower income. And I'm going to go ahead and look right above there where the average income of a chronic homeless is more than the at-risk. And if we look to that at-risk of chronic and look at the type of income needs, there's a lot of individuals who have just found themselves in a chronic health condition. And maybe it hasn't lasted long enough or even begin to be evaluated for SSI or SSDI. So we know that that has to be one of our income strategies. Some of them may have Social Security, diagnosed with that chronic disability. Their incomes aren't going to go up, but maybe they have the capacity to do what they actually do here at Goodwill Industries and provide the type of employment that is enough hours that they can handle and doesn't break the income bracket requirements of eligibility for their Social Security. Obviously, there's a lot of employment opportunities there. Child care subsidy for those families and getting SSI. The housing intervention, some of those individuals is but for a few more months they're going to be chronic homeless and they need that permanent supportive housing. The chronic health conditions, the multiple conditions, the only reason they're not chronic is because they haven't met the time requirement for that definition. Transitional housing, especially for our families with disabilities, and a lot of that transitional housing, of which we have a far fewer supply, can be very effective in stabilizing health conditions to see, or even to wait to see if they have an opportunity for a housing choice voucher, especially for our families. HUD and some of the best practices saying to really target this population also for rapid rehousing. Rapid rehousing, because you don't really know, not everyone, the level of need and the severity of service needs, just because you took a survey, you really aren't going to know until you dig into that case management and discover that despite a significant disability, they have their health care under control. And despite some of the problems and less income, they've got a strong social support system. And so maybe transition rapid rehousing is possible. 6, 8, 9 months worth of rental assistance with case management, slowly wean them off the subsidy until they're on their own, but a lot of help in finding an affordable unit. And then, of course, our chronic homeless, the 208 households, 207 adults, 1 family. And then you see that 51.5 years is the average age. The oldest person is 76, the youngest 22, the average income $443. And all of these incomes are basically, those averages are coming from a lot of zero incomes. And then those individuals who get a set fixed income, maybe through TANF, SSI, SSDI, Social Security, or retirement. Permanent supportive housing is the top intervention, and we talked about the 246 chronic homeless we housed over the course of the last year. Because of the aging, the need for different levels of assisted living care and retirement homes. Bridge rapid rehousing. Bridge rapid rehousing means get individuals off the street. The only program we have right now is through City Square and the Healthy Community Collaborative program that runs through, the funding comes from the state through the city of Dallas. And it's able to stabilize their health and their condition and await an HCV voucher, a housing choice voucher, or perhaps permanent housing. And when we classify it as bridge, they don't lose their eligibility as a chronic individual. So they're still eligible for permanent supportive housing. And of course, housing choice voucher, homeless preference. We have several housing choice voucher, project-based voucher programs within the community, not near as many as we need, but that's also another housing intervention. Those interventions for that category involve a lot more subsidy, much more rent, they're more expensive, and that's why we make sure that we target that intervention for those individuals who are chronically homeless. And the types of income, there's a lot of individuals that need to go through what we call the SOAR process, need help, or they may need assistance with challenging a denial for Social Security or disability benefits. Again, there's some individuals who, once stabilized in permanent supportive housing, have opportunity for some more gap incomes, some smaller employment. And there is, if you are aging, there's a lot of work that often needs to be done to navigate Medicare and Medicaid to figure out how am I going to pay for my assisted living when I'm indigent. There's a lot of work that we need to do in that space. So by the way, I will let you know that this presentation, as soon as we're done, David Gruber will post it on our website, because I really want especially public policymakers to understand how organized we are and how much more we know of the gaps and needs within our community. So now I want to talk a little bit about system performance. HUD now mandates several system performance measures every year, and I wanted to just talk about a couple to show the work of many individuals. How many of you in this audience actually work for a homeless service provider? I know there's a lot of ACU. So the next few slides are really looking at some of their work. Within our permanent supportive housing programs, when they run an annual performance report in the HMIS to look at some of them, 4,550 people have been served in the last year. Of those that exited those programs, 882 of 1,181 exited the program. 882 we call they exited to permanent housing. We call there's permanent destinations, temporary destinations, and then emergency shelter with negative or unsheltered, or we don't know where they went. Those would be negative. So that's a little lower than we've had before, but I want you to remember in the last 2 years, those permanent supportive housing beds are almost absolutely exclusively going to individuals who are experiencing chronic homelessness. And so that still is a very strong number and does represent and support some of the national success. So that's 74%. 471 veterans were served. Persons served with disabling conditions, 2,045. Some of the persons served here would be the children and families, because there's project-based voucher permanent housing in that total 4,000 number. Unsheltered homeless persons that went into that housing, 213. That's why we started several years ago in saying the pathway to housing doesn't mean you have to go for unsheltered to a shelter to transitional housing. We have been very aggressive by saying unsheltered homeless often represent the most disabled individuals and elderly, and they need to be able to be first in line or in the top tier of our housing opportunities, that people can move from housing directly from the streets. Exited with no income sources, adults, that's a good, you want to keep that under 20%, that if people do exit our programs, that they're not left without income, and that we've done our work during their stay in permanent housing to achieve household income. Exited with one or more sources of income, 72%. So we make sure that their disability and mainstream benefits are in order, or that we've attached them to that gap income and employment. Street outreach, 1,202 persons documented served. That means they actually were engaged, the record put in the HMIS system. I can tell you, and I know my street outreach workers who are in this crowd know there's a lot of individuals who, though they're unsheltered, they don't want anything to do with sharing their information, right? They want water, and so it takes a lot of time to build trust and engagement with individuals experiencing unsheltered homelessness. So I know that who have been contacted is more, but these are the ones that are engaging. A lot of times people say, well, the unsheltered just don't want to be helped. I will again go to this list. Probably 25% of them are unsheltered or have been unsheltered in their experience. They are engaging. They're taking the assessments. They're doing the work that the case manager says. And this is the first step to trying to seek housing. 97 exited to other housing, 213. So of those engaged, 26% have achieved a type of housing. That's a good rate, but given the fact that we have seen a 23% increase in unsheltered homelessness, you can see the work of that street outreach just continues to increase despite the success in the last year. So Pieces Iris is the name of the software that we use for the Homeless Management Information System, but it's also the broader product that many of the community-based organizations around the community use, and I want to talk about some of the data that we've discovered. So Pieces Iris is far more than an HMIS system. HMIS is just one subset of the total data product. Information and data from different the community-based organizations feed into this larger data set in order to have analysis done. Primarily, it was built to address and understand correlations and systems that are going on, especially related to healthcare. Dallas was selected as one of the accountable health communities, and it's specifically that project. I think it's a 3-year project. It may be longer, maybe 5 years. I apologize for not having that. And then you can actually Google it through PCCI, Dallas Accountable Health Communities, and learn about that program. Literally, it must address the gap between care, healthcare, and community services. And it's really looking at some of the cost drivers of our local healthcare system. Unmet need related to social needs, food insecurity, unstable housing, which develops chronic conditions, reduces individuals' ability to manage their conditions, and leads to avoidable healthcare utilization, and more importantly to us, and as we have discovered, leads to homelessness. And so when we took back a look, Dr. Anand Shah provided us this the most in-depth look that we've had about our homelessness. Over 11,500 of the continuum care clients in the data went to 2 DFW hospitals in the last 2 years. So it looks like almost everyone. 35% were admitted to the hospital. And what's important about that is that they went to a hospital for conditions that didn't require hospital care, but probably general practitioner or other type of health care. But their practice and their habit is to go to what may be one of the most expensive delivery systems. So you see you have 65% were not admitted. 50% of those who went to the emergency department returned 3 more times. Part of our work, the cottages at Hickory Crossing, and part of our work is we're trying to learn who our frequent utilizers are. And this is getting into that data. 26 of those admitted to the hospital were admitted 3 times or more. You're seeing this episodic experience, pretty consistent with the conditions that you experience unsheltered, especially with the aging of our population. 13% of the continuing care clients are considered high utilizers of the emergency department services. The clients were, if you are in the MDHA database, the HMIS, you were 4 times as likely to be a high utilizer of the emergency department compared to other emergency department patients. We've always known it anecdotally Now we have the data, and on the accountable health community side, on the hospital side, they have the names. They can, because of HIPAA and different rules, they are allowed, they can see our data, they can understand that experience, but we don't see that data. But the fact that these data systems are combined is allowing for this in-depth analysis. I found this very interesting, that cough was the most common reason for presenting to the emergency department. And I'm thinking during the times that we worked in tent cities, we saw individuals in the winter trying to stay warm, burning all kinds of things that you know had toxins in it, plastics. We know the presence of asthma within our population. The elderly, COPD, think of all the different circumstances. The barracks housing, though I know my emergency shelters do amazing work keeping them healthy. When you're sleeping just a few feet from individuals in a barracks housing, health and safety is number one, but sometimes, you know, the flu spreads pretty quickly and other conditions. So it was interesting to me to see that. 40% higher readmission rate. And we know from our Medicaid, our 1115 waiver programs, and healthcare communities all over the United States that one of their performance measures is to avoid readmission. 36% of the clients seen in the hospital have hypertension. And we think about what causes hypertension, right? The type of foods, rest. 13% of COC clients seen in the hospital have diabetes. Think of the correlations there between food and diet and habit and exercise and rest. 10% of clients in the hospital have kidney disease. One individual had 386 emergency department visits in a 2-year span. 36 of our homeless clients visited the emergency department over 100 times in the preceding 2 years. That's 36, each one of those 36 over 100 times. And so we've already began to dig into that data and say we have an amazing Healthcare for the Homeless project through Parkland Homes program. Our work now is to say, okay, we've got to dig into that data. Let's go find those 36 people. We've got to do an intervention. What's going on? How can we provide the health care that is appropriate? How can we stabilize that client? What issues are presenting to make sure that we use that? And when I was looking at, usually every year, I always recommend a book, and my staff is probably rolling their eyes right now. This book has nothing to do with homelessness, and it has everything to do with homelessness. 2 years ago, when I did the State of the Homeless Address, I shared with you all the Healthcare for the Homeless National Council briefing on sleeplessness and homelessness and the correlation of their health. This book specifically presents extraordinary research on the correlation between the lack of the ability to get 8 hours of restful opportunity a night and diabetes and the diabetic epidemic in our country. It also talked very specifically about hypertension. It very specifically talked about the exasperation of mental health conditions because of the inability to sleep. I begged Dr. Woody and Daniel Roby here, I said, you are the keepers of one of the most, the best intervention to some of these health conditions and making sure in those shelters that your residents, your guests have an opportunity to get sleep, and I begged them to read the book. But it also just begins to see, well, when you only get your 8 hours sleep in 2-hour increments over the course of 24 hours, the brain does not get to do what it needs to do over at least about an 8-hour period. The other thing that is just, you know, it's not just about homelessness. I'm telling you, it completely changed my life, and I begged my staff to read the book to make sure I don't have an alarm to wake up. I set an alarm to tell me it's time to go to bed to make sure that I do it regularly. And I'm just saying, I feel better, I'm happier, and despite all the stress of my job, I don't wake up with anxiety attacks anymore. So I'm just recommending it. Put that on your nightstand. It's okay to fall asleep reading the book. That's the point. But I want you to read that. It's a pretty amazing. This is one of the authors I would very much like to bring into the city of Dallas because the correlations to homelessness, chapter after chapter, are absolutely profound. Race and homelessness. Now I'm going to talk about our experience in participating in a project called SPARC, Supporting Partnerships for Anti-Racist Communities. Dallas partnered with the Center for Social Innovation in October of 2016, and we joined other communities, Columbus, Atlanta, Syracuse, Pierce County, which is Tacoma, and San Francisco. And the Phase 1 findings were just published, and we're going to make sure we get it out on our website if it isn't already, or through one of the blogs that David does, and it's pretty phenomenal. We reviewed this, all of the cities here went to Seattle a few weeks ago, and we met the Bill and Melinda Gates Foundation, very intrigued by the work that is done in the relationship to poverty and racism in the United States. And we had an amazing 2 days to drill down and discuss how we were going to transform the different systems. And so we'll talk about some of that. In those cities, 2/3 of the people experiencing homelessness in these SPARC communities were black. 2/3. Poverty alone does not explain the inequity, as the proportion of black individuals experiencing homelessness far exceeds their proportion living in deep poverty. The oral histories that they did in each of these communities, they took those oral histories and the information from focus groups of individuals who were homeless and people of color, and they divided up the areas of focus between economic mobility, housing, criminal justice, behavioral health, and family stabilization. And most of them say, yep, that sounds like homelessness as key areas that we do our work. The lack of economic capital within social networks precipitates homelessness of many people of color. And one of the most profound parts of the report, and I think I remember hearing Larry James of City Square talking about this with a different language, and they've adopted this for the SPARC project, and the study is network impoverishment. It's not just that individuals were experiencing poverty, it's everyone in their social network were also experiencing deep poverty. And in their entire social networks to resolve things within those categories. And let me use this as an example. What is the difference between a person experiencing homelessness and Cindy Crain? Economic mobility. If HUD completely unfunds everything within the homeless response system, I have an education and a social network, and I might be knocking on some of your doors saying I need a job. HUD just cut all of our funding. And some of you might actually interview me. But I have that opportunity. I have a network of places I could probably go and try achieve housing. If I lost all of my income, I actually have equity, an asset in my home, that if I had to sell my home, I have real access to real liquefiable cash. Or maybe I lost all of that. Almost everyone in my social network is a homeowner with not just a couch, but a bed and a bedroom. And it would probably take me 5, 6, 10, 15 years to wear out my welcome at all these different friends' houses. So I wouldn't find that. And if I made my dad homemade ice cream and apple pie, I would stay forever. So, but what I'm showing is that that's what we mean by that network impoverishment. Criminal justice system. If I leave here and go crazy and just drive through a bunch of red lights and a police officer pulls me over and there's an empty bottle of wine in my back truck, I can tell you I can afford a lawyer. So I can get the best defense and get off. And so many of people experiencing poverty, especially people of color, that's just something that they don't have access to. Behavioral health, I've got health care. It's got mental health care provided in there. And family stabilization, well, we won't go into my personal life, but I've got 2 good kids, they're grown and they've got jobs and I'd have a place to go. But not meaning to be funny, that it is real. There are individuals that every single one of these focus areas, these domains that cause homelessness, they are impoverished completely because everyone they know is in the same boat. Family destabilization, the strain, poverty just eats away at family stabilization. And a lot of those individuals who work in family homelessness know about that. The other thing they talked about is the damaging and that these tensions and this poverty sometimes, especially for people of color, are exasperated. Things go on in my life, no one's going to call CPS on me, but that's usually not the experience of people in poverty. Someone calls CPS on you. Happens much more frequently for families of color than not. Or the criminal justice system is brought in a whole lot sooner in these impoverished communities. And so that's something that you have to realize. Intimate partner violence, especially amongst African American women, very common narrative that they found from the interviews. And health, very inconsistent or limited access to mental health services, to hospital care. We know that, right? We just learned that from Iris. They present at the hospital with a cough, where you and I might go to a Doc in the Box or just go to Eckerd's and buy everything on the shelf that says cough relief. But if you have no money to buy the medicines, what do? You seek health care. So they also did, and this, I just opened this up yesterday, this is our report. This report is specific to Dallas, and I'll also get that on our website because I want you to read it. The black population in the city of Dallas, 18.7%. Black population in that deep, extreme poverty, 30%. But wait a minute, blacks represent 66.7% of the homeless. This is what they mean by saying, this is more than poverty. There is something going on within our systems, within our economic mobility systems, with our employment system, our education systems, our housing systems, and it goes on and on. Some of the recommendations they made for us is to make sure that our coordinated assessment system is equitable when it comes to race, and it is. When we looked at all the data related to who got housing, absolutely, there is no difference. 80% of the people on that list are African American, 80% of the people getting housing were African American. So we know that we have built a system, we believe we have a system. Incorporate racial equity into grant making and decisions. So when we're reviewing grants and applications, or the people of color have an opportunity to be at the table when that happens. Include racial equity in our data analysis, and we've started doing that. We have a couple of reports that we produce, and then we also, that tracker, we also produce that and examine it from a racial perspective. Support and hire racial equity within organizational development. Last year I showed you a slide that showed you the CEO of everyone in the homeless response system, and I think it was like of the 32, there were 3 that were African American. Yet remember, our clients are 66.7% African American. So we have to do our work as CEOs to say, are we giving opportunities for upper management and decision making and program management and CEOs within our organizations? And what they also discovered from a little more deeper dive in other communities, that the only difference in why I may have 15 years experience and an amazing African-American woman may have 20 years experience, you want to know what the difference is I got the master's degree and she did not. And there's so many of us that make that as a, well, then you can't. And that goes back into that social network impoverishment. She wants to get a master's degree, but she doesn't have the $65,000 to pay that tuition. And so we have to think about that. Wait a minute, it isn't that they couldn't achieve a master's, it had to do with opportunity. And so we have to think about that. And one of my goals is to also begin to work with the Center for Nonprofit Management, or CNM Connect, and say, you do a lot of amazing leadership training. I really would like to see some training that targets, especially within the nonprofit community, who proportionately are addressing most of their clients are African American. I would like to see them do a real racial equity lens in some of their training. And so that's one of my ideas to try and pursue in the next couple of years. And innovative health strategies. If we've got this kidney disease and hypertension and diabetes, and the majority of those individuals are people of color, should we rethink our delivery system? That's part of that accountable health community work and a part of what we're learning through the IRIS system. So here's the work we're doing right now, and I'm kind of excited, and this is not everything we're doing, this is just the highlights. You're saying, well, wait a minute, Crain, you didn't say a whole lot about youth, right? Our LGBTQ youth, and I know lots going on. That's because the youth committee is going to be doing their own event on April 19th, See Us Now. The Outlast Youth, Promise House, and the team did a deeper dive and did a different pattern and surveying of youth experiencing homelessness. They're going to, Texas Appleseed and TNOS, the Texas Network for Youth, are going to be doing a report. Outlast Youth also engaged with True Colors Fund, which is also a key player within the SPARC community, and I was with them in Seattle. They're going to be doing some training to help build the capacity of our work in the nonprofit sector and developing an organization very focused on LGBTQ issues, especially related to youth homelessness. So write that one down. That's going to be another amazing event to really learn about the exciting things that are going on within this space. After 8 to Educate, that DISD Center, the collaborative project with City Square and Promise House, so you'll learn about that at that event. One of the things that we put in the strategic work plan last year is that we want to do what Georgia did, and they did this emergency shelter housing challenge. And our Adult Services and Emergency Shelter Committee has been working on it, and we're going to kick it off in April 1. And I said, well, what's your all's goal? And they said, we're going to house 90 people in 90 days. And part of the strategy, since we already have coordinated assessment, is start working the middle and the end of this list. Those individuals that have a lot of assets that they bring to the table. These are the 3 shelters there, and I understand that I think Union Gospel Mission is also going to try to find its space in this effort. And we're going to do it for 90 days. Our goals are to improve the actual coordination, improve how we use this list for those with lower acuity, basically on the bottom of the list, when are they ever going to have a housing opportunity? Begin to say that shelter space should be the shortest stop that you have. We know our lengths of stay are extraordinary. HUD set a national goal of 30 days. Oh, you saw these 2 years, 4 years. We're not there. But we want to be able to make sure that our shelters have the tools they need, the case management staffing they need to make sure that they can do the type of housing placement, navigation, and counseling necessary to get people housed. And then we're going to continually learn from what we did over 90 days and do it again. And if we find that we have a gap in our service or something not working right, we're going to change it, test it, and do it again. And then maybe even bring more. We've had some technical assistance from the National Alliance to End Homelessness, a conference call that went through how they did it in Georgia and doing it in another community. So that's a very exciting event. One of the other things we're working on in preparation for that is how do we dialogue? So my coordinated assessment team, James and Cynthia, have been doing different focus groups. They started with the Homeless Alliance Forum at the downtown library, and they went into Austin Street, and they have another one today. And they're sitting around in a room of people who've been in shelter a while and just say, what's your barrier? What's going on? What's not working? What tools do you need? How can we help? And I wanted to share, because I wanted to make sure I have client voice in the State of the Homeless Address. These are things that came from that. They wanted someone to care. Think about that network impoverishment and perhaps the family destabilization, the isolation and loneliness of homelessness. They're ready and they want to get started today. When we started talking about our concepts and ideas, they go, let's go, let's do it. Do you have it with you? Like, well, we haven't developed it yet. One individual said, I'm just sitting here. I love my case manager, but you know, those case managers have a 1 to 50 caseload, and they have to wait their turn, and they want to do something. They want to be active in solving it. They all talked about where they wanted to live. And they said, I don't want to live in the ghetto, I want to live downtown in Dallas. I mean, it's vibrant, it's lively. Where can I have an opportunity to live downtown? They want to be close to their work. They talked about getting their IDs. And still, after all the work we have done to make it a smooth, easy process to get an ID, there are still individuals who don't know how to, don't know about the resources available. About wanting to have personal counseling and grief counseling. And my team heard things like safety and grief several times, which is fascinating. You realize, think of that network impoverishment, the loss of any of those elements that led to their homelessness. Any one of those things would send any one of us into deep depression. And most of them are experiencing multiple facets of loss: income, family, health. They said that even though they knew they had to wait for a case manager, they were like, I am totally into doing it in group case management. If that helps me talk to someone more often, I don't mind doing group counseling in a way, because they understand the ratio of client to services. They want to meet with their peers and talk in private, like at a restaurant. There's almost no way not to develop friendships. You want to get over the isolation, but sometimes they feel like there's no safe space to just talk about what's going on. There's always someone, a homeless service provider or a case manager in the room, always. And they want to be able to have that opportunity to have private space as an adult, just like you and I would. They really enjoyed the focus group. It was just a conversation. There was no HMIS system open, clicking in everything that they said. There wasn't some impersonal thing being checked off. There wasn't someone, did you do this? Did you do this? Did you get that done? Did you go to that meeting? There was just a conversation about their needs. And I know that the case managers in this room wish they had the luxury to dig a little deeper and not just be all about eligibility assessment. But that's just the reality of having hundreds and hundreds of people in one shelter, and the shelter's doing the best that they can to meet the needs of their clients. And they took this seriously. And so one of the things that we're going to be, and they wanted a safe space to speak. So it's interesting, what do you mean by what's not safe? Worried if I say I did this or this happened, would that make me ineligible for a service? So it was very interesting. And so one of the things that we're working on is developing this curriculum called My Housing Plan. Literally, The first statement that we've learned in some best practices is you show up and you're sitting down with your case manager, you're fed, you're showered, you're safe, you have a bed. Okay, what's your housing plan? What is your housing plan? Well, I don't know, I never thought about it. What are some of the assets that our clients bring to the table? And so we're working up a curriculum, My Housing Plan, that's going to walk through 3 key stages. And this is totally riffed off of the Presbyterian Night Shelter program that they did in Fort Worth. They don't do it anymore, they've changed it. But step 1, and some of this language is designed by some of those focus groups. The step 1 is let's get going. And literally a notebook with curriculum and say, all right, what's my vision for housing? And start writing down my ideas. What are some of my personal strengths? Sometimes we so often overlook and think that on that column of housing opportunities and income opportunities, that those are the only assets we have, and we forget about the individual client. And these individual clients and these focus groups talk about, well, I've done this before. Most of my life I wasn't homeless. I've held jobs before. And then they began to talk about their different barriers. Make sure those critical documents in order. Get them working. Literally a notebook of work for them to do. Moving up. All right, now that I've got my vision and I've wrote my own personal plan, maybe I'm going to take that ready-to-rent training that Daniel Roby of Austin Street told me about the first time that we met years ago, and we have 5 certified trainers. We need to make sure, let them go through that curriculum. It's a very excellent curriculum that understands their rights, their tenant rights, the processes, what it's like, how to present yourself to landlords. Resolve barriers. We can run a tenant screening report, and we can examine that. And we can be able to tell, well, you might not know this, but you have 13 evictions. So before we even go see a landlord, let's see what we can do to clean up that record. Did you know you had a warrant out in DeSoto? Whoops, didn't know that. We better take care of that before we go apply for our driver's license, right? So there's things that we can do, and we're moving up. We're taking care of business and getting the work done. And then moving out. I'm ready. My household income may not be quite here, but it's pretty close. And then we do that housing search and placement with some of our other staff, helping them prepare for the landlord, find that housing, figure out where they can piece it together and figure out a plan, and then move out. And one of the things that we developed over the course of the year with our AmeriCorps Vista program was a new tenant resource guide. And so when people move into their housing, they have this whole notebook that teaches them all kinds of things, what the bus route is, gives your voter registration card, and update your address. Make sure you get your mail that used to go to the stew pot, and let's make sure it's coming here. All kinds of free stuff to do in Dallas. Because, you just spent all your money on rent, but you're not just going to sit there, right? And be able to understand that process and to moving out. And so we're hoping to get that launched in April, mid-end April, beginning of May, in correlation with the Emergency Shelter Challenge. So we have a lot of work ahead with a 23% increase in unsheltered homeless, 9% overall. We're going to be doing something for the first time next week. We're going to have a continuing care leadership and strategic planning retreat. And it's going to be next week. We're all going to meet on Tuesday night, meet and greet and talk to each other. And then we're going to hold up the top floor of the downtown library, lock the doors, and for 2 days we're going to think big thoughts and strategically plan and have very safe and candid conversation. We have 11 national leaders coming into the space. Ian DeYoung, who's been in Dallas and knows a lot about Dallas, and Anna Leva, who formerly of HUD, 10 years experience pretty much running all the nation's homeless programs. And so she's going to be part of that. The United States Interagency Council on Homelessness representative will be here, and we also have 7 COC leaders like me from around the United States who have many, many years experience to bring their expertise and their knowledge to our group, and we have 65 of our local leaders going to be participating in that. We're going to be learning about the different strategies, and very specifically to come up with some ideas around what we discovered from the SPARC. Those core areas that we find at the core areas, those domains, if 70+% of our homeless are African American, people of color, and they have told us around the country that those 5 areas are key areas that either contributed to their homeless or are barriers to them getting out, that we're going to organize our strategic plan around those big impact domains. We've added a 6th, Reverend Waters, and the Faith Forward community said, you've got to have community engagement. And I said, well, then let's add it, because there's different things that we can do. And so what we're going to be doing is developing what I'm calling, I usually do a continued care strategic work plan, right? It's kind of siloed. It's really about the continuum of care. And so this is going to be a homeless response to a consolidated strategic plan. Meaning we're going to consolidate the ideas of different organizational spaces. Hopefully they will incorporate themselves into our plan. It'll be a high-level community plan covering 3 years. And I know that my job it'll be built out of 3 annual plans. So we're going to have year 1 of the Homeless Response System Consolidated Strategic Plan. Who's going to do what action items between those different goals and objectives. We hope to have a draft by April 13th that will be on our website, on our listserv, to get as much input as possible. We hope that we fine-tune it, get it final, and get the endorsement. It'll literally be a passage by the Continued Care Board of Directors, but we hope that the Citizens Advisory Commission on Homelessness at the City of Dallas, maybe the Dallas Area Partnership, Collin County Homeless Coalition, these different entities will find themselves and endorse and have input into the plan. And then we'll finalize it, the strategic plan, and then we roll up our sleeves and do our work and develop our action plans. Takeaways from today. Homelessness is increasing all across urban America. And I want you to remember 4,140 is the number of homeless on that one day. People move in and out of homelessness, probably to the tune of 10 to 11,000 people will experience homelessness over a course of a year. Homelessness continues to be profoundly correlated to race. When you dive into the SPARC reports, you'll even see that even more acutely, that it isn't about systemic deep poverty. It's something far more and systemic. We've got some successes that veteran and chronic homelessness are decreasing. Homelessness, especially unsheltered homelessness, is aging. Families with children are facing longer stays in homelessness. And the demand for safe, affordable, and accessible housing, quite frankly, it just outstrips our supply. The success is that the homeless response system is more data-driven and systemically structured than ever. I meant to print off, it was probably twice of this, our business rules, our continued care policies and procedures. We have things in place, we have employees in place, we have rules in place, we have processes in place. We're getting data updated weekly. We have a very strong infrastructure for the homeless response system. And we communicate and collaborate and we meet and we meet and we meet and we meet, and we're going to continue to meet. Extreme poverty is still the primary driver. The inability to get those household incomes to match what it costs to live. So we have to build household incomes, and we must build safe, affordable, and accessible housing. When we finish that homeless response system consolidated strategic plan, different organizations, they may not be able to buy in year 1. Who I've already got a commitment from, especially when the space of the criminal justice domain, Unlocking Doors says that is really tracking. And I said, well, would you produce an Unlocking Doors action plan as it relates to homeless? Absolutely. Faith Forward, very interested in saying, what do we need to do as an organized group of faith leaders, especially as it relates to community engagement? So that's what I'm imagining, is that we have a plan and then people find where their role is. And then the actual rollout becomes deeper and wider because we've engaged individuals and they found themselves. And so part of that process for our strategic planning and development is this event and your words and thoughts. And now I would like to turn it over to individuals. There's a mic there. Comments, questions. I went 60 minutes, which was my plan, and I'd just like to take 10 or 15 minutes for people to ask questions and comments. And I've got a staff who'll write some ideas down, and go ahead. Commissioner.
Well, good morning. And first of all, a big hand of applause for Cindy Crain, because it takes somebody willing to make that first step forward, and I think Cindy has definitely stepped forward, along with so many, 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 many other people on her board, on her staff, and in this room who are doing so much. I'm Teresa Daniel, Dallas County Commissioner, but also have the distinct privilege, some may see the short straw, in being the co-chair of the Dallas area partnership with Dallas County and the City of Dallas, working together to, first of all, support the efforts of MDHA and Cindy, because they're the primary organization dealing with housing and homelessness here, plus all of the other variety of service providers and consumer groups, just a lot of other people who are involved in this process. The other piece of what the partnership hopes to do is exactly what Cindy was talking about in the end, and that is finding the spots that are not being covered. And by the partnership, the dream, the ideal would be to increase the amount of affordable housing by working with developers and funders to see what we can do to do that, because most of the organizations that are represented here today don't have a staff person to do that, may not have the contacts or the expertise to do that. But that is something that hopefully the partnership can get down and really begin attending to, because the whole point of it is that all of us together in this room are much stronger than working by ourselves. So let's see what we can do. So first of all, you know, thank you to Cindy and MDHA and all of the efforts that are going on here. Look forward to reading more deeply into the report and just seeing, you know, how can we be more effective in addressing so many of the things that we're dealing with. So hey, we're not done yet, but there are certainly some big steps taken to attempt to address what we're talking about here. Thank you very much.
Good morning. Really appreciate your presentation. Just had two questions. Your rapid rehousing, how long is the stay? How long are they allowed to stay once they're in it?
It depends on the program. Short term means 6 months or less, the design. The Emergency Solutions Grant, Rapid Rehousing, most of those grants are 1 year. So you're thinking maybe 12 months. Those funded under the Continuum of Care, a different pot of HUD money, could be up to 18 months. We have a policy that we set, but the whole goal is to work people off the rental subsidy. And it's flexible enough to be gradual. So it's like, I could never do first and last month's rent. We get that taken care of. We pay up, maybe a program is 100% of your rent for a couple months, and then the third month you're up to 50% of your rent, then you're paying 75%, then you pay 100%. Allows you to economically build a little asset. So it depends on the actual program. So usually some are 6 months, some 9, some a year, some 18. And it also depends on the individual family household, how quickly they advance. So it's not a set in stone. Some may only need it 3 months, some 8. It's designed to be flexible.
Very good. And my apologies, Ron Abrams, Texas Veterans Commission. I also had a question concerning pay or work. Are there any organizations, companies, entrepreneurs that are willing to come to where they are to provide some type of work, money in their pocket, things of that nature?
I know the Bridge has a work program, employment program. Austin Street has an employment program. I'm assuming Salvation Army does. I don't have any within us, and I will say it is absolutely one of the largest gaps of being able to find. You can find temp jobs. Those aren't careers. To find career sustainable employment is a large gap in our community, no doubt, and I hope we talk about that at the retreat next week. But if any of you who have programs in the shelters, yeah, and Union Gospel Mission is here as well to talk about that, yes.
All right, thank you.
How you doing, Cindy? Robert Ceccarelli, how's everybody doing? I came here for a plea real quickly. I see about 200 people here. I go to both homeless commissions. I'm the only one that speaks. Only one. I'm getting very frustrated about this. It's going nowhere. I'm asking you, please, instead of just telling me what the problem is, why don't you go in front of the public, like I'm doing right now, and tell about the problems. What I'm looking for right now is housing as quickly as possible. I'm working on a Dawson State Jail. I feel like the city has shelved it. I don't know, but I'm really asking everybody, come to these meetings. The next one is Friday at 1 o'clock. They have the Homeless Commission, the citizens, and the partnership. And if you really want to help, what the students did in Florida, how they rallied around people, I want you to do the same thing. If you got problems with clients about housing, go speak up about it. Don't be scared. I've asked many people to speak up. They're scared. I'm getting very, very pissed that I'm the only one that's speaking, really. So if you want to help out these homeless people, I'm called the poster child for the homeless. I've been in the newspapers and the CBS 11 News. I'm getting very frustrated. I'm the only one doing it. So please, if you want to help, instead of just coming here, come Friday and talk to the partnership with Ms. Daniel and Mark Clayton, and you got the Citizens Council next month. And that's the only way it's going to get done. If you don't do it, like you said, with the students in Florida, if they don't rally and really get into it, nothing's going to happen. I'm getting fed up with it. Please do it. Thank you very much.
Thank you, Robert. And I will say, when someone doesn't want something to happen, I know that there's some extraordinary efforts going to expand homeless services by one very large organization, and it just takes 2 or 3 very angry people who don't want you to provide homeless services anywhere near their home. They're usually the only one that speak, and so I am going to affirm that we have to have advocates for homeless to present themselves other than a couple of folks. If we don't speak up, then it isn't going to change. When you have city council or county action or any community, if there's an issue at the table and the only people who speak are a few angry people who are very vocal, and they're certainly not afraid, and that's usually the only voice. So I think we have to work on that community engagement component within our plan to make it a safe space to fight for homeless people in our community. Ricky.
One of the things I really liked about your presentation was you mentioned something that a lot of people overlook, and that is sleep. And one of the things I do when I get a problem is I don't read a book, I read a stack of them. And I did that with sleep. I read a stack of books. One of the things that happened to me when I became homeless is I stopped to reason with myself, how did this happen? Well, I made some very poor decisions. That's how it happened. And then I reasoned, how am I going to get out of it? Well, I'm going to have to start making some good decisions. But wait a minute, how do I do that on 4.5, 5 hours sleep every night? So this is not going to be easy if I'm not getting enough sleep to start to turn this thing around and start making good decisions. Now, one of the things I've heard from some of my street friends is that UGM is now giving everybody an extra hour sleep. I felt all along that UGM was the best shelter for sleep because you got a bed to sleep in, a bed with a blanket and a pillow, and they shut everything down. Now you can't stop people from snoring, but they had a solution for that too. They would give you a strip for your nose if you wanted it, so that you could stop snoring. But sleep is so important. A lot of people don't realize just how important that is for good health and for a lot of different reasons, mentally, physically, your health. And so I think that's something that needs to be addressed. Is I always wondered, why am I getting up at 4:30 in the morning? What am I going to do? Who out there is going to give me a job interview at 6 o'clock in the morning? So I've got 2 to 3 hours of dead time where I'm accomplishing nothing, where I could be sleeping. And so anyway, it's just, I was glad to see you include that into the presentation. Thank you.
Thank you, Ricky.
Good comments, Ricky. Cindy, my question is there any one project that you've seen in another community that Dallas does not have that we should have? If you could pick one project that you've seen that we could start here that we don't have, what would it be?
Well, we're fixing to do it, and that is other communities will come together and do these short-term challenges. Like it's ramping up the energy, focused on doing housing. Corporations Board of Housing, Rapid Results Institute, a lot of the communities did that for veterans, and that's how they got it, because it was just hyper-focused on a goal. Everyone was involved, and you knew we've housed 2, we've housed 3, we've housed 4, and it was just a sheer energy, motivation, and cooperation. And we had to have a lot of things in place, so that's one of the ideas. The other idea that's much more at the macro level that I only know about 2 seconds of it is in Houston. They've had 2 major hurricanes that have just upended their social. When Katrina happened, all the people moved to Houston, and then after the Harvey over this last summer, one of the challenges that they realized is the city and the counties have come together and say, we need to go out and look for, I'll say shovel ready, but vacant apartment complexes, those that are under receivership, those or whatever, and you go, we know another something is coming, and we continue to get caught with no access to apartments and housing. And so I know they're working on figuring out a plan to literally go out and look about the entire inventory. And rather that it gets bought by private developers and then flips over and then becomes unaffordable, that they're going to start to accrue that. Now, I don't know, there may not be a lot of property available here because of the housing market, but that was one thing that they were going, we know we need affordable, safe, decent housing. So let's get it while the property's cheap, let's negotiate it, and oh yeah, we're also government. We've got some influence and some say in some different things, with zoning and planning and property, and really beginning to build the supply of real property within their public space so that they can not just respond necessarily to homelessness, but to other emergencies that they have access. So that is one really, they're developing that plan, and what's also interesting, they're deeply cooperative, deeply cooperative. I mean, there's no naysayers in the room. They're like, yes, we're going to do it. How do we legally do it? How do we get the financing? How do we get the funding to do it? And I think that's kind of an interesting and something for us to watch because it's just south of here.
Hi, my name is Annette Cullors, and I think you kind of answered my question when you talked about reducing housing. How can you reduce homelessness when housing is going up, food is going up, property, everything is going up, but salaries are still below poverty? I mean, when you talk about putting all these people out and trying to get them a job, most of them that have a job, they just can't afford to pay. And in Dallas, especially with Dallas growing right now, housing market is really going to go up. Rent is going to go up, apartments. So how do we reduce the homelessness when they can't afford to even live?
Absolutely. One of the strategies that we're going to start creeping into, because we have no choice, is there's not a lot of one-bedroom apartments in our community, and there's a little more two-bedroom apartments, and making sure that we understand all the rules around subsidies and HCV and different vouchers, and do what we did when we were poor college kids, start getting roommates. Now, I don't want to, I mean, that's hard. I mean, just imagine, right? It's hard living with people. But we're seeing this in other communities. Like, we have no choice. We're going to have to figure out how to take these 2 incomes that are not enough and figure out how to pay that rent and make sure we do everything that HUD says or whatever the subsidy is, or even just private market, and look at that. And that's one of the processes that we're going to be looking at over the summer, probably in the phase 3 of our emergency shelter challenge. If you've been sharing tent space for 3 years, you know, we might be able to figure out how to take those 2 SSI checks and get you an apartment. When we suggested that to a couple of veterans last year, it didn't happen, but one of them is about, I want my own refrigerator in my own room, right? Because I don't want them taking my food, or, you know, that's my beer. Just like college, right? Just like college. But that's one of the strategies, is given what we have, we can't just go, well, there's no housing. We have to figure out how to solve this problem, and with whatever assets that we have. Mr. Butler.
Like I said, good morning. I'm Bruce Butler, CEO, Union Gospel Mission Dallas, and just want to thank you for your presentation today. And like all the other people that are here, want to let you know that Union Gospel Mission wants to do its part of being part of the solution and not the problem. I just recently returned from a a visit to Washington where I learned about Envision centers that Ben Carson and HUD is coming out with, where they're partnering and they have something dealing with economic empowerment, educational advancement, health and wellness, and character and leadership. And for me, as a leader of a faith-based organization, the thing that I'm really happy about is the fact that they're encouraging faith-based organizations to get involved, where oftentimes we're on the outside looking in, we're participating and helping with the problem, but we cannot receive any of the funds. So I'm hoping that during the retreat, et cetera, that we would consider starting some of these Envision centers in the DFW area.
I like it, and I know DRC wrote it down. I like the phrase too, Envision Center. That's excellent. Thank you very much, Bruce. Yes, ma'am.
Hi.
And you're a member of the Citizens Advisory Commission, aren't you?
I am,
On homelessness?
I am.
Yes, ma'am.
Yes, my name is Tisha Owens. I am the founder of Where Are You Homeless Outreach, and I would like to make a suggestion. Is there a way with you all having leadership that we can combine or create some type of expo or an event where every single organization in the city of Dallas can literally come together, whether we hold it in a convention center or something, where we literally find out who these organizations are that supply these resources, so we can say, I would like to delegate this person or this group can do this or that. Because when I saw the North Texas Giving Day listing of all these organizations, I couldn't believe all the many that were out there. And I knew no idea of who they were, but seeing those names, I thought, well, what if we all came together and we literally created a plan where every organization found out what this person did or that person did, and we literally came up with a plan to join forces and make some major changes.
That sounds great. Sometimes communities do connect events, and we've done a mini, like a networking, speed dating thing for professionals, but that's not getting to the real roll up your sleeves work. So absolutely my staff is here, and let's think about strategically planning a more in-depth networking event that's very client focused. Yeah, and invite everyone. That's a good idea. That's a good idea.
Yeah. Thank you. Thank you.
Excellent. Thank you.
Is there any effort to coordinate with the private sector developers who are throwing up apartments all over this town, that in order for them to get their permits, they have to donate at least one unit into their complexes?
What was the...
Teresa, can you address that? You and I have talked about that before, but is there anything like that going on where you can just, you know, either drastically reduced subsidized unit or a what? Okay, we'll talk.
A very aggressive housing policy that addresses the lack of affordable housing. And I think, what was the, Mike who did the presentation, what was the name? Opportunity Dallas put out a really excellent YouTube and presentation about a month ago. That has amazing ideas, that digs down into what you suggest, and he has these 6 key domains, one of which is racial equity, that really digs into those policy recommendations. And I don't know where it is now, but it's a really excellent thing, and I'll make sure that my team connects to that presentation in our State of the Homeless work, a link on our website. So it is, we're 2 minutes over. Anyway, thank you very much. I encourage you all, swap business cards with folks, and this presentation and all the materials referenced will be on our website or probably out on our listserv probably within a day. Thank you very much for coming.